HIV AIDS. HIV, human immunodeficiency virus, and AIDS, acquired immunodeficiency syndrome, are closely related conditions caused by the same virus. HIV weakens the immune system over time, making it difficult for the body to fight off infections and diseases. AIDS is the final stage of HIV infection, characterized by severe immune system damage and the onset of opportunistic infections and certain cancers. Here's a breakdown of HIV and AIDS. HIV, human immunodeficiency virus. HIV is a virus that attacks the immune system, specifically the CD4 cells, also called T cells, which play a key role in the body's defense against infections. HIV can be transmitted through sexual contact, sharing needles, contact with contaminated blood, and from mother to child during childbirth or breastfeeding. The virus can remain asymptomatic for many years, during which time it continues to replicate and damage the immune system. Stages of HIV infection. Acute infection. Within a few weeks of exposure to HIV, many people experience flu-like symptoms, which can include fever, fatigue, rash, swollen lymph nodes, and sore throat. This stage is called acute retroviral syndrome. Clinical latency. After the acute stage, HIV can enter a long period of clinical latency, also known as chronic or asymptomatic HIV infection. During this stage, the virus is still active but reproduces at very low levels. People with HIV may not have any symptoms or only mild ones. AIDS. Without treatment, HIV can lead to AIDS. AIDS is diagnosed when the CD4 cell count drops below a certain level or when a person develops specific opportunistic infections or cancers. These conditions take advantage of the weakened immune system and are typically uncommon in people with healthy immune systems. AIDS, acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection, characterized by a severely compromised immune system. Individuals with AIDS are more susceptible to various opportunistic infections, which are typically controlled by a healthy immune system. These infections can include pneumonia, tuberculosis, and certain types of cancer. AIDS-defining illnesses are infections and conditions that are indicative of severe immune suppression and are used to diagnose AIDS in individuals with HIV. Treatment and prevention. Antiretroviral therapy, ART, is the standard treatment for HIV. ART involves taking a combination of medications that suppress the virus, allowing the immune system to recover and reducing the risk of developing AIDS-related complications. HIV transmission can be prevented through measures such as practicing safe sex, using condoms, using clean needles, getting tested and knowing your partner's HIV status, and using pre-exposure prophylaxis, PrEP, for individuals at high risk of HIV. Early diagnosis, access to medical care, and adherence to treatment have significantly improved the prognosis for people living with HIV. However, there is currently no cure for HIV, and ongoing research continues to explore better treatment options and potential cures. Thanks for watching. Please subscribe.